Apollo Genomics Institute's Navi, Mumbai is increasingly making its footprint in genetic diagnosis management and caregiving to patients and their families. In this month, with upcoming Genetic Counseling Awareness Day, we take this opportunity to retrace idea of genetic counseling, its way of scientific appropriate communication alongside the psychological and socio-economic aspects.
We at Apollo have added a new dimension to cancer care, and that is focusing on genetic cancers. We test our patients, we counsel families, and we give specialized multidisciplinary management for these cancers if diagnosed.
Nowadays, we have treatment available for those patients who have got genetic mutation. The most common example is breast cancer and ovary cancer. There are certain drugs like PARP inhibitors, well-known name are olaparib and rucaparib, which can be given in patients who are having BRCA1 and 2 mutation. And these drugs are very effective and having very less toxicity.
Fortunately, only 10% of breast cancer is hereditary or familial. You need to understand whether it's associated with a breast cancer mutation. The commonest ones we all know of are BRCA1 and 2. So how does one understand what tests to get done, which gene to test for? We urge you to first understand with a genetic counselor what your benefits are, what getting tested means for you, and what is the right test to do. Talk to your oncologist about it. Don't fear breast cancer. Discuss the genetics.
Radiotherapy plays an important role in treatment of colorectal cancers, and 5% of these cancers are hereditary. So it is very important to do the genetic counseling and testing in such cancers.
Almost 20 to 25% of all ovarian cancer patients that we see can have hereditary ovarian cancer, irrespective of whether or not there is a family history of cancer. Hence, we do recommend genetic counseling and genetic testing in all of them.
Much has been spoken about women's cancer which are genetically related, like breast, ovary and endometrium. I also want to bring to your attention certain type of thyroid cancers which can be genetically related. A timely genetic counseling can help you detect these cancers and even help your family members from having this disease early in the process.
Genetic testing is an important tool that we can employ in pregnancy, and there is a certain type of people who are more advised to go in for genetic testing. In Apollo hospitals, we have a very good department which takes care of your needs and all your questions and queries.
It is highly recommended that women who are planning to get pregnant undergo genetic counseling in the following situations: those who have had recurrent miscarriages, those who have been unable to conceive for a long period, where there is a stillbirth or an infant death, and women who are pregnant also need to undergo screening tests to understand the probability or carrying a high risk of a chromosomal abnormal baby.
In today's era, genetic tests can be made use of in arriving at a definitive diagnosis. There are various disorders like suspected inborn errors of metabolism, hematological disease, neurological diseases, or if there is an index case of a disease with genetic background. I would urge my fellow pediatricians and colleagues from other medical specialty to send their patients for genetic counseling so that a proper understanding is made of genetic test and it is utilized for better management of patients.
Diagnosis of many neurological conditions is possible in this day and age primarily because of advanced genetic testing. But once a diagnosis has been made, people are at a loss to understand where do we go from here. This is why we offer genetic counseling for all these cases, and this is best done at Apollo Hospital, Navi, Mumbai.
So as a radiologist, I need a lot of places genetic counseling, like when we examine a fetus and we see increased thickness at the nape of the neck, which is the nuchal translucency, or we see limb abnormalities, facial abnormalities in kidneys, heart or brain, any of these abnormalities, we require genetic counseling to evaluate the fetus.
Different types of laboratory testings like cytogenetics, molecular genetic testing, inherited metabolic disease screening, and fertility testing play a crucial role in diagnosing genetic disorders, assessing risk, and guiding personalized medical management. Within each laboratory, genetic counselors work closely with the laboratory supervisors and technologists.
Genetic counseling plays an important role by helping and identifying high-risk individuals for developing health conditions. We at Apollo PHC offer preventive measures for individuals and families. We identify the patient based on the clinical history and guide the patient to meet the genetic counselors.
Genetic counselors provide genetic communication by being licensed between patients, other healthcare providers, laboratories, and many other departments. They help by giving their expert understanding on how to communicate information most effectively. Thus, as genetic counselors toggle between this art and science of genetic counseling, I, on behalf of Apollo Genomics Institutes, wish you all a very happy Genetic Counseling Awareness Day.